So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after let's discuss this test step by step. So it's 12-year-old boy. He has fatigue, which is a non-specific symptom. Also he has easy bruising, which tells us about disrupted secondary hemostasis, and nosebleeds, which tell us about affected primary hemostasis. Also he sleeps excessively and he has poor appetite, which are non-specific symptoms. From anamnesis we know that his paternal uncle has hemophilia, and there is no information about his father. He is pale, and paler usually is due to the decreased hemoglobin level. Decrease in hemoglobin we call anemia. He has hematomas on buccal mucosa and petechia. Petechia tell us about affected primary hemostasis, and hematomas tell us about affected secondary hemostasis. From physical examination, we know that he has lymphadenopathy, splenomegaly, and hepatomegaly, and basically it's all what we know. So our approach here is to rule out pathologies one by one until we will find the right option. Decrease in von Willebrand concentration is a feature of von Willebrand disease. In von Willebrand disease, frequent nosebleeds are present and petechia are present, but everything else is not related to von Willebrand disease, so we can rule out this one. Hemophilia A looks like a tempting option. His paternal uncle has hemophilia, but it will be more suspicious if maternal uncle had hemophilia. Easy bruising is a characteristic feature of hemophilia. Nosebleeds can be present, but they are non-specific for hemophilia. Hematomas are a characteristic feature of hemophilia, and petechia can be present, even though they are more specific for primary hemostasis. But in hemophilia, anemia is absent and lymphadenopathy is absent, so we can rule out this one. Autoantibodies against platelets are the characteristic feature of immune thrombocytopenic purpura. In immune thrombocytopenic purpura, easy bruising can be present, but it's a non-characteristic feature. Two major features are nosebleeds and petechia. Hematomas typically absent. But what should not be present is anemia and lymphadenopathy. So based on these features, we can rule out this one. Bone marrow infiltration by blast cells is the feature of acute leukemia. Fatigue can be present. Easy bruising is not a typical feature, but still can be present. Nosebleeds due to the thrombocytopenia is a characteristic feature. Anemia is also a characteristic feature. Hematomas can be present. Petechia due to the thrombocytopenia can be present. And lymphadenopathy due to the extramedullary hematopoiesis is a characteristic feature. So it looks like acute leukemia is the correct option here.